Okay, moving on to actually Obamacare. It is called Patient Protection Affordable Care Act, PPACA. Okay, so what does it cover? It covers ambulatory services. It's what it's supposed to cover. Ambulatory services, which my insurance company covers all ambulance services, and that literally means an ambulance coming to your door, picking you up and bringing you to the hospital. It does not cover, my insurance does not cover if you get an ambulance to the hospital and then you end up coming home that night. If you can get to the hospital and then go home, it means you could have taken your ass there in your own car. And talking to all of my EMT sisters and brothers, because I was an EMT as well. I was an EMT for close to 6 years. I saw some horrible shit, and I've seen some really good shit. I've seen some funny shit. Okay, so the biggest complaint from an EMT is getting called for no fucking reason. You have a sniffle in your nose, you do not call a fucking ambulance. If you fell down and scraped your damn knee, do not call an ambulance. If you broke your leg, maybe. If you broke your femur, which is this long bone right here, your lap, if that one breaks, call a fucking ambulance. If you break your lower leg, you can hobble your ass into a damn ambulance. With a femur fracture, you're probably going to go in and have surgery that day, so they're going to keep you overnight. I'm not talking, I know everything about hospitals. I don't know everything about every hospital. I will straight up say that. I'm going from my experience. I had a guy call me and he broke his toe and he asked me to bring him to the fucking hospital. Are you shitting me right now? He woke me up at 2:30 in the goddamn morning, and every EMT knows this fucking story. Is you go to their house. They're sitting on the fucking porch. They're not even sitting inside. It means they hobbled their ass out to the porch. And this, if y'all don't know, there was a flood down in Columbus. I was working in Columbus at the time. And this man was and the flood took out the hospital. All of the lab was taken out. All of the ER was taken out. And the ER was actually in trailers. And there was an imaging area that was in the back of the trailers. But there was like 4 trailers that were lined up. That was ER. So you didn't go there unless you had something seriously. You didn't even go there if you needed anything serious happen to you. If you sat there and, had a traumatic injury or something, you better be having an ambulance or a helicopter hauling your ass as far as you can, or as fast as they can, to Franklin, which was 30-some plus miles away, or Seymour, which was another 20-something miles down the street. So this was literally a Band-Aid station, and the essence of a word of a Band-Aid station. It was trailers lined up outside of the hospital. That was the ER. So they wanted me to take them to the Band-Aid station. I said, no, they are not accepting ambulances right at this moment. He asked me to bring him there, and I said, I can't. They are not accepting ambulances. And in my position, I can only go by what my doctors tell me. And what my doctors are telling me at the hospital is that they are not taking any emergency cases, any whatsoever. They were a walk-in clinic at that time. So, until they got their emergency room back up. So, now they have, this man would not listen to me. I said, okay, if you want to go to the hospital, if you're in desperate need of a hospital because you're stubbed, I did not cuss at him, but if you are so desperate to go to the hospital right now, I will take you to either Jackson County, which is Seymour, Schneck Memorial, or I'll bring you up to Johnson Memorial. That is 45-minute drive, pretty much either way. And he said, no, it is an emergency. And I said, well, those are the only 2 places that are accepting emergencies. So you have to go where I can take you. So, this is the shit that pisses off. You do not call an EMT an ambulance driver, by the way. That is just mean. We do a shit ton more than just drive an ambulance. I do know how to drive an ambulance. It has saved me in this job that I have now. But it has made life a lot easier driving, period. But you do not call them an ambulance driver. That is not their job. Their primary job, primary job is driving the ambulance for these dumbasses that call in for fucking Stop Joe. But anyways, your insurance company is not going to cover that. And I have tried telling people over and over and over again, if you need anything from the hospital, you can make your ass there, and you don't think that you're going to be admitted, take your fucking self. It's not that big of an emergency. If it's that big of an emergency to you, take yourself. Okay? I will even say take yourself if you're pregnant, because you'll probably get there faster because they have to get to you and then they have to get to the hospital. Either way, it's going to take time. And if you just get off ass, put the fucking phone down, and stop asking for delivery service, take your own ass to the ER, you get there faster. Now, Affordable Care Act, I'm going through all this stuff. It covers mental health services, substance abuse disorder services, behavioral health services, prescriptions, rehab, lab services, preventative health and wellness services. And that includes, if you go to give blood at a blood drive, you will get something from your insurance company. You just got to ask them what you need to give to them to prove that you donated blood. So normally it's whatever pamphlet they give you or some information about actually donating. It should cover some oral health, so anything with your mouth and anything, and vision insurance. Obamacare, whatever you want to call it, Medicaid, your the Healthy Indiana plan that I know of, you get you pay $10 and you start having coverage. I guess it's something close to what Indianapolis had to the Wishart Health Advantage or something like that. Back in the day, it was sponsored by Wishart Hospital, which Wishart Hospital is a state-run facility, and they get most of their funding from the state. Now, Wishart had closed down, and it's called Eskenazi Health. So that actually gets funding from the state of Indiana. So whatever the Healthy Indiana plan or the Hoosier Health Eyes or whatever, if it is anything that has Eskenazi in there or even Wishart in there, it is like Wishart Advantage. I know there's some, broke ass people like myself that has been on Wishart Advantage, and it pretty much covers everything done at Wishart. The Affordable Care Act also talks about women's health, which they have the extra screenings. They should be covered, like the breast exams, pap smear exams, contraception should be covered in some form or fashion, and that is the pill, patch, the IUD, whatever you want to call. Those are covered under the Affordable Care Act and under Obamacare. They should be covered unless there is a big fucking unless you work for a company that has religious beliefs that go against the contraception. And that was the big lawsuit and whatnot against the Affordable Care Act, and that's from Hobby Lobby and Chick-fil-A. If you don't know, and this is the worst thing the only thing that I really, really hate about Chick-fil-A is that they're closed on Sunday, and this bitch never wants Chick-fil-A unless it's a fucking Sunday. So, and since I'm pagan, I don't really realize it's Sunday, and I don't go to church, and I don't realize it's Sunday, then I roll up Chick-fil-A and fucking closed. It's bullshit. Just saying. It's bullshit. But anyways, now back to healthcare. But they also had annual and lifetime caps that they would only cover a certain amount of money. They put a restriction on health insurance companies that they could not have an annual or a lifetime cap, which means people like my brother-in-law, when he sat there and got sick with mesothelioma, if he had a regular health insurance, he would have been dropped within seconds. He would have spent so much, and he died in 2002. So it's like you sit there and you think 14 years ago. about to be 15 years ago. It's going to be the 15th year here in September. But 14 years ago, actually, it is 15 years ago because that's when he got his treatment and whatnot. But 15 years ago when he got his treatment, he would have been he would have been taken off his medical insurance because his medical insurance would have said, you're going to cost us way too much money, so we're going to get rid of your insurance. And that is just a shitty fucking thing to do. So you're literally asking for this man to die because you don't want to cover him under insurance. And that covers anybody that has gone through anything like similar to that in the last decade. Like, if your mom, your brother, your sister, your cousin, whoever the fuck it is, even if it's a friend, if they have gotten severely sick before Obamacare, they would have been kicked off their plan because the insurance wouldn't have want to cover their shit anymore. They would have gotten even sicker because they couldn't get the medicine they fucking wanted, or the medicine they needed to keep going. My brother-in-law didn't do the chemotherapy because he wanted quality of life before quantity of life, and he didn't have the chance. He sat there and had Medicaid. He had to have Medicaid because he didn't have a job. He ended up losing his job because he was always sick. He was getting sick and thought he had the flu and this, that, whatever. Ended up having mesothelioma. And it was just because of a random trip to the ER that the ER doc sat there and saw it on the x-ray. So, I mean, there's a lot of things that there's problems with our insurance. Like, you can't get dropped also because